Hello, my name is Jacqueline Smith and I live in Raleigh, North Carolina. Today we will be engaging in a debate regarding post-secondary choices for individuals with disabilities. We have chosen an informal structure for our debate as we believe this makes the debate more understandable and accessible to a larger audience. I am playing the role of introducer for the topic as well as presenting research and visuals to support the counterpoint. Sarah Clark from Pendleton, Indiana, will be introducing the point argument for this debate, as well as presenting research and illustrations to support the point argument. Christina Brereton from Newcastle, Delaware, will be introducing and summarizing the counterpoint information, as well as presenting research and presenting visuals for the counterpoint argument. Later on, Sarah will act as the fielder for the question and answer section, and I will be concluding the debate. Now I'm going to go ahead and turn it over to Sarah.
Okay, I'm going to go ahead and introduce the point part of the argument here. It may be a common misconception that individuals with disabilities are unable to define what they want in life. But according to an article by Petner, Array, and Copeland in 2014, they found that individuals with intellectual disabilities that they interviewed knew what they wanted. So it is our belief, if given the opportunity, individuals with disabilities can identify what they want and become more self-sufficient and independent. However, when we're talking about this topic, autonomy can be difficult to define, especially for persons with intellectual disability who may have limitations in expressing their autonomy. So that's why it's so important to listen to the needs and wants of the individual so that they can lead their lives that are consistent with their needs and desires so that their lives reflect what is important to them. And again, that's from research by Peter, Array, and Copeland in 2014. To summarize the point article, we have a couple points here to talk about and just go through briefly what those are and some of the subtopics there. So point number one for the point argument or view number one, although there is future research that is warranted, there's data that show that when empowerment, self-advocacy, and positive outcomes are present for individuals with disabilities, it increases the positive outcomes for them. And so we're looking for them to have self-determination, empowerment, and self-advocacy to increase that later on positive outcomes. And there's several articles that we're going to talk about. One article is about self-advocacy and how it contributes to positive identities for people with developmental disabilities. This is one of my favorites, one of my favorite articles that I found, and we'll go through that a little bit more in detail here in a second. This was by Anderson and Bigby and was written in 2015. And then another article is talking about self-determination, and it's talking about how self-determination can work to increase work motivation. So basically, when individuals' interests and choices contribute to their future employment choices, they will be more likely to complete the job responsibilities with less need for external motivation or rewards. So this is a really interesting one for us as we look at it from a behavior analytic point of view and really trying to have that natural reinforcement or that intrinsic motivation to work towards doing a better job rather than having to have extra rewards and reinforcements associated as well. And that article is by Gagné and Dici, and it's from 2005. And then we're going to look at significant difference in outcomes for those who were taught self-determination as a part of a research by Waymeyer, Kelchner, Richards, written in 1996. The second viewpoint we're going to look at is in regards to our code of conducts, our ethical compliance codes. So in order to practice within those guidelines that are set forth by the BACB, we have to empower patients to make their own decisions regarding their treatment and future outcomes. So there's several codes that I'll go through more in detail when I go through the research portion of this. But for now, I'll just list those codes. The first one is code 2.02. The second is code 4.02. And the third is code 4.03 Part A. So we're going to go ahead and quickly move from the summary of the point argument and move on to presenting the research behind this point argument. So the first article and research we're going to talk about is regarding self-advocacy and how it contributes to positive identities for people with developmental disabilities. This particular article is by Anderson and Bigby from 2015. And just to give you a little bit of background information, the participants were put in self-advocacy groups. And those were the intent was to create positive self identities to give them a little bit of independence, and things such as that. The individuals were playing the key roles in these self advocacy groups. So it wasn't like the groups were created by an outside agency or outside individuals, but it was actually the research participants that played the key roles, such as president, such as speaker, and some other things that we'll go into a little bit later. But they advocated for themselves and also played the key roles for their own advocacy group. So that was a pretty neat study. And the results of the study showed that the participants gained a sense of control and ownership by taking part in these self-advocacy groups. And these groups increased skills for them, such as being a self-advocate, being a business-like person, being a professional, and an independent person. So there were some really quality positive outcomes that came out for these people that participated in these groups, but also were the leaders of the groups as well. There were a couple limitations. One was the size of the participants in the study, as the group of individuals was small. They all participated in some way in these self-advocacy groups, but of course, we'd love to have further research with more participants included. Also present is a lack of data regarding other individuals who may have more moderate or severe disabilities, and I think that kind of segues a little bit into some stuff we'll talk about later. Because for this research project, it was mostly individuals with what we would define as mild developmental disabilities. So there wasn't research included for those people that might have a little bit more of a severe disability or even a more moderate disability. In conclusion, for this study, the study was to determine the importance of self-advocacy, and it resulted in individuals developing more positive self-identities, gaining more independency, and their self-advocacy can result in increased empowerment for those individuals with disabilities. So it was a really neat study to read through, and I think it does a lot to support the point, and some very cool stuff. I'm going to go ahead and pull up a visual from that particular study and just kind of show you guys that visual and explain it just a little bit. And again, this is from Anderson and Bigby. Their research was in 2015. So I will pull up the visual. So what we see here is a flowchart that identifies the way that participating in the self-advocacy groups contributed to multiple possibly positive identities. For this particular study, the potential for positive identities for those individuals participating in the group included becoming a self-advocate, an expert, a business-like person, or an independent person. And all of the participants in the study reported an increase in positive identity due to the availability of involvement in their own self-advocacy groups. So that was, that was a really neat study where they benefited from running their own groups, but also benefited from being in these self-advocacy groups. Okay, quickly moving on to article number 2. This one is about self-determination and how self-determination can work as a means to increase work motivation. We talked about that a little bit earlier. This article is called Self-Determination Theory and Work Motivation. This study in the article encompassed how higher scores of self-determination contribute to work motivation. So basically saying that if there was that self-determination, then there was a higher work motivation. So very cool stuff. Intrinsic motivation as a part of this study related to the individuals enjoying their work. So being able to choose their own work and then inherently enjoying it because they chose that, and then doing, a better job with that work as well. According to the study, intrinsic motivation is increased by the individual's interest in an activity. There's a couple of limitations to study, excuse me. There's an absence of relatable data to show the difference between an individual who does not have intrinsic motivation and an individual who does, and the difference in their job performance. So basically, this is kind of like a positive study where we did look at these people that had higher self-determination and who had higher intrinsic motivation and being able to choose their own jobs, but we weren't able to look at the comparison between people that might not have as much intrinsic motivation and compare those two. So that's definitely a limitation there, and that's further study would be, further research is definitely warranted for that. And then intrinsic and autonomous and extrinsic motivation are not observably measured as a part of this study. And of course, that's important to us as behavior analysts. So we want to see a quantitative, a qualitative way to look at the data. So that's a limitation as well. In conclusion for the article, intrinsic motivation and autonomous extrinsic motivation or interest in enjoyment in the task result in motivation to complete that said task. And both of those things play a role in performance, satisfaction, trust, and well-being in the workplace. So you can see why all of those are really important and contribute a lot to that person's future. I do have one visual to show here for this particular article as well. So this is the, just one second, self-determination article. What you can see here is a chart that shows some of the results of having that intrinsic motivation. So it's an organizational chart that provides a clear visual explanation of how intrinsic motivation, which is said to be associated with individuals making their own choices on employment based on their own interest, relates to positive job outcomes. The following improvements can occur in relation to autonomous motivation, performance, psychological well-being, organizational trust and commitment, and self-satisfaction. So you can see why all of those things are so important. And again, I just pulled those from this figure 2 from this article. And this is an article by Gagne and Dici written in 2005 again. So bring myself back up here. All right, moving forward, I had one more research article before we get into the ethics. And that research article was written by Waymeyer and Schwartz in 1997, and it's talking about when empowerment and self-determination are taught to individuals with disabilities, positive outcomes are present. So again, just talking about how making their own decisions and being taught to be have that self-determination as well as giving them empowerment, how the positive outcomes are present in those situations. According to the results, individuals completed the ARC self-determination scale taken from previous research by Waymeyer and Kelchner in 1995. Results showed that those who scored higher on the self-determination scale were more likely to maintain a checking and savings account and more likely to be employed. So those were two important things that came from the study. There were a couple limitations. Results were based off of self-report and parental report measures, which can be affected by bias on the part of the reporter. And we know that that's kind of like an indirect way of looking at this data by interviewing them. And then another limitation, the measurement data was taken, was observable and therefore less subject to bias by reporters. So I take that back, that although that limitation was present, there was some observable data, so that's really good. A second limitation, the study did not take into account different educational experiences based on the type of disability present or where the participant lived. So again, we could be missing out on some more moderate or severe disabilities, and different schools are different in different places. So as far as the results on the study, they just showed that there were several positive outcomes for students who had higher self-determination levels, including having a bank account and being employed. So really, really important parts of post-secondary life. And I'll wrap this up by going into the compliance codes, as I talked about earlier in the summary. So looking at the ethical guidelines, code 2.02 is the responsibility of a behavior analyst. Analyst responsibility is to all parties affected by behavior analytics service. Behavior analysts identify and communicate who the primary beneficiary of services is in any given situation and advocate for his or her best interest. So we know there we're looking at, we want to advocate for those individuals to be empowered and for their guardians to take a part of it, and also other people on the team, but definitely advocate for their best interests and what they want to have as a part of their post-secondary choice. Code 4.02, involving clients in planning and consent. Behavior analysts involve the client in planning and consent for behavior change programs. This plays into teaching self-determination and empowerment to clients who are transitioning to the next stage in life. They should be deciding what goals they want for their own future, just as they would in their behavior change programs. So that's going to be really important as they move to the post-secondary life, and also important as we serve them either after that time or before that time. Code 4.03, Part A, behavior analysts must tailor behavior change programs to the unique behaviors, environmental variables, assessment results, and goals of each client. Again, just talking about involving them and tailoring things to their needs and their desires, and how important that is as behavior analysts. And that may not look the same for individuals with more moderate or severe disabilities, but we definitely want to do everything that we can to include them in their own decision making, especially about their future. I will go ahead and pass the introduction of the counterpoint on to Christina.
Okay, so it is not legislation or service providers' intent to hinder the autonomy of individuals with disability with their future planning in adulthood, and it's not our intent to remove their sense of self-determinism. Legislation and service providers wish to continue to empower individuals with disabilities by protecting them. The system of care, which includes funding and resources, is in place to aid individuals with disabilities in their transition and continuum into an adulthood. Legislation like the Rehabilitation Act ensures individuals with disabilities have the opportunity to receive services such as training and employment coaching. It also ensures funding is set aside for these resources, so individuals and their families who may not be able to afford them can access them. Housing is also available, and it can assist individuals with disabilities to live in a less restrictive living situation, which will be more appealing. With these initiatives, individuals with disabilities can be qualified for more opportunities of employment and are at lesser risk from discrimination in the workplace and abuse in living arrangements. Hopefully, more options are available to these individuals due to legislation and funding, so they can make the decision that would make them most happy. The system of care provides supports and boundaries to set individuals with disabilities up for success while protecting their vulnerability by ensuring resources to these programs exist, are planned for, and holding companies accountable. So the summary of our counterpoint, we have the view that the system of care laws and legislation exists to prevent the mismanagement, abuse, and lack of voice individuals with disabilities and their families were once subjected to in the very near past, to ensure resources such as funding exist and are allotted for state to state. The Rehabilitation Act was created. The Rehabilitation Act helps individuals obtain their goals and meet their goals by providing training, and it also protects them from manipulation in the workforce. They ensure that these resources are available, as government or agencies would not be held accountable to do so if it did not exist. And then the other viewpoint to the counterpoint of this argument is granting total autonomy to an individual with a disability may not be practical in most cases. An important part of our daily living as adults includes the ability to make decisions and acknowledging the consequences these decisions may incur. Having difficulties in these areas can lead to poor choices that may have significant negative long-term effects. For example, individuals with autism have been shown to have poor decision-making skills, therefore allowing them independently to make their decisions. Post-education regarding school or living arrangements may not be possible. However, that does not mean they're not involved with these outcomes in their adulthood. Rather, the individuals are given complete control of their decision. A view of interdependence versus independence should be put into play. So for support, we can first look at the codes of compliance. And that is, again, the behavior analysis are responsible for their client and their client's treatment. If you look at code 2.05, the rights and prerogatives of client, that the rights of our client are paramount to support their client's legal rights and prerogatives. By having legal services and resources in place, we are assisting our clients' rights and advancing in their adulthood. We look at code 2.09, treatment and intervention efficacy. Our clients have the right to effective treatment, and we have the obligation to advocate and educate the client of what is available for them and the most effective treatments. We also have the responsibility to advocate for the appropriate amount and level of service provision. So we are to educate our clients on their decisions and opportunities that exist and present to themselves. And as the IEP does for school-age children, for adults, you can see the individual plan for employment, the IPE, in which the individual should be involved and is supposed to make informed consent regarding their employment and residential status. Also, behavior analysis, if needed, should assist or advocate appropriate means or service a client requires to live their best life and make their own decisions to keep them happy, healthy, and safe. You can also look at code 7.02b, the ethical violations by others and risk of harm. If a situation where a client is not being treated fairly or is a risk for harm, this code holds us responsible to take necessary action to protect our client. Legislation assists us with these codes. If the client is being abused in the home or the workplace or forced to do a job that he or she is not happy with, we are to help them fix the situation. You can also look at legislation regarding future planning for young adults with disabilities. It begins in the education system, often with person-centered planning and the students and their families' long-term vision. Again, it's not the legislation or service providers' intent to take away independence, more so to provide boundaries, guidelines, and rules to ensure these decisions are able to be made and resources are able to be there. So if we look at the article by Maiden, Sheldon, Appeal, and Degrassi from 2010, they propose families, educators, and practitioners work together to create a roadmap of learning experiences, support, and services an individual may need. Oftentimes they started this while they were in school, so families had a head start at preparing for what resources they may need, and for teachers to make goals that could be functional in the adult workplace. Maiden and et al. Also provided case studies of clients of all different levels. With one student who was nonverbal, they provided pictures for her to pick her desired employment decision, where she was able to circle her choices. And then they have provided a case study of a student who was verbal and was able to communicate this through an interview. And then also we looked at I'll show you some visuals, but the following graphs are from a national longitudinal study for post-high school outcomes of young adults with disabilities conducted by Newman et al. In 2011. And I'll pull that up. So, sorry, 1 minute. So in the study, they looked at these students' satisfaction in their living arrangements, and with this information, Newman et al. Looked at what resources still needed to be provided. You can see the highest levels of satisfaction is up to 5 to 8 years post high school graduation, where they are living independently. And then the highest was when they were living semi-independently as well. Newman also looked at paid employment outside the home for individuals with disabilities. It's also, this table is also broken down by different, various different disabilities and their level post high school, and then 8 years after. And you'll see very few were able to maintain the level of employment. Again, Newman and I'll use this information to see what resources still needed to be provided for individuals with disabilities. So again, it's not their intent for service providers to take away their independence, but to ensure that resources are accessible. And it's also an important consideration on how practical it is that individuals make decisions regarding their life independently. And Jackie is going to explain more on this.
Okay, so when discussing the point that individuals with disabilities may not be able to fully engage in the decision-making process due to difficulties stemming from their disability, we looked at research that focused on individuals with autism spectrum disorder. Gace, Levin, Jane, and Bjork in 2016 found that individuals in their study with autism spectrum disorder show greater difficulty in a variety of everyday decisions. They show greater aversion to social risks and lower levels of rational ability and greater personal endorsement of socially undesirable acts. Specifically, they found that thinking style, attitude toward risk, and perception of social norms are predictive of difficulties in everyday decision-making, as well as with personal relations. A few visuals from this study. Pull this up. Okay, so this table shows that when comparing groups on rated difficulty with a variety of everyday decisions, it can be seen that individuals with ASD have significantly lower ratings, which range from 1 being extremely difficult to 10 not being difficult at all. And they had greater difficulty for each item and compared to the control group. There were especially large differences for the following areas: when to go to bed, what clothes to wear, what to eat, when to shower, and when to take medications. Because of the importance of significance for quality of life, we're going to look at this next table, which provides individual item analysis, this time for group comparisons on items for decision outcomes that they refer to here as bad decision outcomes. Almost every item showed a significantly higher rate of reported bad outcomes by persons in the ASD group compared to the control group, with 10 out of the 14 items reaching a significance level of 0.0001. The ones that seem most likely to affect quality of life included quitting a job after a month, being late on a rent payment, borrowing money and not paying it back, having to use an emergency credit card to get out of debt. And looking at these together, results displayed are consistent with previous research on decision-making, difficulties experienced by adults with ASD. And just a second. All right, I'm back. Also, we'll take a look at another bit of research because we wanted to look at alternatives to complete decision-making since some of them may not be capable. Waltz, Spielmans, and Cardle in 2016 suggested that service providers play a vital role in preparing young adults for independent living. They stated that it is within relational interactions with staff, parents, and others in their social circles that young adults learn skills, gain confidence, and find solutions to problems. For both of these studies, limitations were simply the gender and age group. Women weren't very well represented. And in the Gates study, many of these participants had participated in surveys for compensation in the past, which may have an effect on the results that were shown. And I think we are ready to move on to our question and answer, which we will turn it over to Sarah.
So we did get one question. The question was, are there practical strategies and things that we could recommend for caregivers, families, therapists to do to ensure a smooth transition into post-secondary life? So we all kind of looked at some different things, and we came up with a research article by Kellums and Morningstar. It was written in 2010. There are several things that can be done to help ensure a smooth transition for the guardians, the family members, everybody involved. One would be being involved in the planning is essential from the get-go. So some of this planning can start when they're 13 years old. So just making sure as a guardian that you're involved and they're involved from the very beginning. There's several tips recommended. Parents need to be informed of the process of transition as described by the IEP for this child. So study the IEP, know the IEP, staying informed and using the IEP as a checklist because there are steps of everything that needs to be done. And you can ensure all steps are completed towards a successful transition. And this can aid in keeping the student themselves on task as well as the parents and administrators and other people in the group. Parents can and should begin questioning the plan set forth by committee by the child's 16th birthday and possibly before, as the planning can start around the age of 13, as I said before. Parents can also play a role by doing their research and staying informed of what the options are that are available for their child following high school, and then having ongoing conversations with their child's team about options, needs, steps towards transition, and with the child about their ultimate goals. Parents, caregivers, and guardians should stay up to date and be present at all available meetings, should stay up to date on information and program that are available for their child, and be from the beginning to the end. And those were the tips we found. And again, that's from Kellums and Morningstar, written in 2010. And then we will move on to Christina with our conclusion.
I'm not Christina, but I will do the conclusion.
Sorry, Jackie. Moving on to Jackie.
In conclusion, there are numerous studies that both support the point and counterpoint that individuals with disabilities should be independently involved in decision-making, or they shouldn't be just based on the level of capability. Following our research and our participation, I think it is safe to say that post-secondary decisions need to be individualized in order to meet the needs of so many different types of people with differing levels of disabilities. With one individual, it may be best practice to completely empower them to make their own decisions regarding post-secondary choices. And with another, it may be best practice to ensure the individual is protected by determining whether he or she is able to make her own decisions. Just as we must individualize our own plans to each patient in behavior analysis, plans for post-secondary education must also be individualized to protect the rights of the individual. Thank you guys for listening to our debate. Thank you, Sarah and Christina, for your participation. And that's it.